Thank you very much for joining this interview. My name is Jung, a corresponding author of this special article titled Tumor Enucleation for the Treatment T1 Renal Tumor, a Systematic Review and Meta-Analysis. I served as coordinating editor of Korean satellite of Cochrane Urology. It's an honor to introduce our leader to ICUrology leaders. Was collaborative work with Yonsei University and Jeonnam National University and supported by the Center of Evidence-Based Medicine Institute of Convergent Science, Yonsei University. I will be providing the result of article briefly in this interview. We performed this systematic review according to rigorous methodology that Cochrane adopted. Partial nephrectomy has been the gold standard treatment for T1 renal tumor according to current guidelines. Tumor enucleation, which involves tumor resection without additional removal of normal renal tissue, has been increasingly used as an alternative treatment with a rapid increase of robotic surgery. However, it is not clear whether tumor enucleation is associated with more clinical benefits and fewer adverse events in clinical practice than partial nephrectomy. Therefore, we aimed to evaluate the clinical effects of tumor enucleation compared to partial nephrectomy for T1 renal cell carcinoma. We performed this systematic review according to the protocol published in Prospero. Comprehensive search of several databases as well as other resources such as trial registry and gray literature report. All clinical trials were included regardless of publication status and language. Participants aged over 18 years with a T1 renal tumor were enrolled. We compared tumor enucleation and partial nephrectomy. Tumor enucleation and partial nephrectomy were defined as follows. The primary outcomes were residual renal function, overall mortality, and major adverse event. The secondary outcomes of this review were cancer-specific mortality, local recurrence, distant metastasis, positive surgical margin over adverse event, and hospital stay. Two independent reviewers performed screening the literature, data extraction, risk of bias assessment, and data synthesis according to Cochrane Handbook. Certainty of evidence was assessed according to grade approach. The grade approach involved a 4-tiered rating system of high, moderate, low, and very low, which reflect a gradient of confidence in estimate of treatment effect. The certainty of evidence for almost all outcomes in this review were rated as low and very low. Found 17 trials, including one randomized controlled trial with 3,300 participants. Age of the participant ranged from 51 to 64. Tumor size ranged from 2 to 4 centimeters. May result in little to no difference in short-term residual renal function based on two studies with 256 participants. Mean difference was 1.04 with 95% confidence interval ranged from 0.25 to 1.83. The certainty of evidence is low. No study reported overall mortality. We are uncertain about the effect of tumor enucleation on major adverse events based on very low certainty of evidence. we are uncertain about the impact of tumor enucleation on cancer-specific mortality, local recurrence, and distant metastasis based on very low certainty of evidence. Rates was similar based on 14 studies with 2,528 participants. Risk ratio was 0.72 with 95% confidence interval ranged from 0.44 to 1.17. The certainty of evidence is low. Uncertain about the impact of tumor enucleation on other adverse event. Considering minimal clinically important difference is 1 day, tumor enucleation may result in little to no difference in hospital stay based on 6 studies with 982 participants. Mean difference was minus 0.71. The details for the review, including risk of bias judgment, can be found in the published special article. As a result, while tumor enucleation appeared to have similar effects on short-term post-operative residual renal function, positive surgical margin, and hospital stay, there were uncertainty on oncologic outcomes. However, we need rigorous randomized controlled trials to elucidate the effect of tumor enucleation, as the evidence stems mostly from non-randomized controlled studies. Thank you very much.